First, we'll finish the last couple of slides of our first posting. Then we'll finish the blood part 2. So we are talking about the red blood cells. And you know that hemoglobin is a red colored pigment present inside the red blood cell. And the color of hemoglobin is red. That's why the blood is red, because of the presence of hemoglobin inside the red blood cells. Now, hemoglobin transports gases, oxygen and carbon dioxide bind with the hemoglobin, and hemoglobin transports those gases. If you measure the concentration of hemoglobin in adult male in 100 milliliter, that means 1 deciliter, that means 1/10 of a liter, that means 100 milliliter of blood, the concentration of hemoglobin is 14 to 18 gram per deciliter or per 100 milliliter, same thing. In adult female, it is slightly lower. The concentration is 12 to 16 gram per 100 milliliter of blood. Now, why in female the concentration is less? Because you know that the count of red blood cell is lower in female. You remember in last class we have talked about that. So now it is very simple. If you take 100 milliliter of blood, the number of red blood cell, if this is male and this is female, the number in same amount of blood, the number of red blood cell is less here, right, in female. So the amount of hemoglobin will be less because hemoglobin is inside the red blood cell. Here you have more red blood cell filled with hemoglobin, so the concentration or amount is more here. Here red blood cell, that's why the amount is less, because of less number of red blood cells. Now, the structure of a hemoglobin molecule. In a hemoglobin molecule, you have 4 heme units and 4 globin chains, amino acid chains. So these are heme. How many? 4. Heme molecule or units and 4 globin chains. In each heme, if you see the structure of a heme, has iron in the center and other chemicals around it. So iron is in the center. So this is the hemoglobin. Here you have the iron in ferrous form. Remember, this is important. Fe2+, not ferric. Ferric has 3+. Okay. So iron is in ferrous form in the center of the heme. Okay. Here you see Fe2+. Okay. This is the heme and other chemicals around it. Make sense? So you have other chemicals around the iron. So that is the structure of heme. Now if you see the globin part has 4 amino acid chains, 2 alpha, 2 beta. Make sense? So that is the structure of a hemoglobin. And why iron should be in ferrous form? Because oxygen can bind easily with this iron when iron is in ferrous form. If iron is in ferric form, 3 plus, oxygen cannot bind with this. Okay, so we need this one. Make sense? So that is the hemoglobin. It has heme and globin. 4 heme and globin has 4 amino acid chains, 2 alpha chains, 2 beta chains. Now, the destruction of red blood cells. The lifespan of a red blood cell is only 3 to 4 months. You remember in last class I mentioned 90 to 120 days or 3 to 4 months. Since the red blood cells don't have nucleus, red blood cells also don't have mitochondria. Okay? So no nucleus, no mitochondria. So the red blood cells have short lifespan because control center is not there, right? Powerhouse is not there. You know, mitochondria is called the powerhouse. We have talked about in NP1, right? So no control center, no powerhouse inside the cell. So the cell gets weak. After 90 to 120 days, the cell membrane gets very fragile, easily get ruptured. Okay. Now, in most of the cases, I have mentioned already, the red blood cells are destroyed where? In 2 organs. Spleen and liver, called the graveyards, right? So, most of the red blood cells, when they enter into the liver and the spleen and try to pass through the narrow capillaries in those organs, they get ruptured, okay? Old red blood cells. Now, if red blood cell is ruptured, who comes out? Hemoglobin, because hemoglobin is inside it, right? So, hemoglobin comes out. You see, this is a macrophage inside the red blood cell, and macrophage engulfs the red blood cell inside the liver or spleen, whatever you see. Here you see spleen or liver. So, this is the red blood cell, aged or old red blood cell. It is engulfed by the macrophage, and the heme and globin part you see here gets separated. Hemoglobin has 2 parts, remember? Heme and globin, right? And globin is amino acid 4 chains, 2 alpha, 2 beta. So, you see that heme and globin amino acid chains get separated.
It gets recycled?
Yes, and they will, now you see that from heme, not the whole heme. Heme has iron in the center, right? Remember that? So this iron part will be recycled, not other chemicals. Okay? So now you see from heme the iron will get out and will be taken to the bone marrow to produce new hemoglobin. Is it clear? So iron will be recycled as well as the amino acids. Globin part will be recycled to produce.
The heme and the globin is that recycled?
Right. So basically the iron and globin amino acids, okay, will go back to bone marrow and will be reused to produce new hemoglobin. Is it clear? Now rest part of heme, other chemicals will do what? You see here, other chemicals. These chemicals will be converted to a chemical that is called biliverdin. Biliverdin. Okay? So, rest part of heme. Heme has iron and other chemicals, right? So, iron will be used again, but other chemicals will be converted to biliverdin. And then biliverdin will be converted to bilirubin. Have you heard bilirubin?
Yes.
Okay. What's the color? You should know. Yellow. That causes what? Jaundice. Is it clear? So, the bilirubin will be produced Now bilirubin is yellow colored pigment, and that will get out from the body with two things, feces and urine. Is it clear? It should get out, right, from the body, because red blood cells are being destroyed all the time, right? So bilirubin is being produced in the body all the time. So it should get out regularly from the body.
What is it before it's bilirubin? You said it's bilirubin.
Biliverdin. Virdin. Okay, so bilirubin gets out through the urine and feces. Make sense? That's why the color of urine is yellowish, right? Because bilirubin is getting out all the time, and feces yellow. Is it clear? Okay. So just know that that is the fate of a red blood cell. What happens after the lifespan is over. Okay. Now, just a couple of conditions: hemoglobinuria and hematuria. If hemoglobin breakdown products are found in the urine, that is called hemoglobinuria, and hematuria if the whole red blood cell gets out with the urine. So if you take a drop of urine and see under microscope, if you see the whole red blood cell, intact red blood cells, that is called hematuria. That can happen due to kidney disease, filtration of kidney. If that doesn't work, that can happen. You have these slides on blackboard. Okay.
What was the first one?
Now let's go over the second part. Red blood cell disorders or erythrocyte disorders. One common clinical condition, probably many of you have already know, anemia. Have you heard that? Very common, right? Anemia. Anemia is a condition where the blood has decreased ability to carry oxygen or transport oxygen. Is it clear? Decreased ability to transport oxygen. Very simple. Now you tell me, who transports oxygen? Which type of cells? Red blood cells, right? So if red blood cell count is low, that will cause anemia. Now you tell me, if I go more inside, which component of red blood cell transports oxygen? Hemoglobin, right? So if the hemoglobin concentration is low, that will also cause anemia. So either red blood cell count or hemoglobin amount, okay, is lower, that will cause anemia. So decreased number of red blood cell, decreased amount of hemoglobin, both can cause what? Anemia. Is it clear? Okay. Now, you know that oxygen is essential for metabolism. You remember? Oxygen and nutrients. Those two things we regularly get from outside, right? 24 hours we get oxygen. So if oxygen amount is low in your body, the metabolic activity will go down. Make sense? Because oxygen is needed for metabolism. And that will cause fatigue. The person will get tired easily, okay? And shortness of breath and chills, because metabolism also produces heat in the body. We know that. So if metabolism goes down, all those things will happen, right? The person will easily get tired because metabolism produces ATP. We know that, right? So ATP production will be low, right? So you'll get tired easily. Shortness of breath will occur because oxygen carrying capacity is low, and person's body will be cold. And another is paleness. Since the red blood cell and hemoglobin, right, gives the color, red color of the blood. So if the count of red blood cell is low or hemoglobin amount is low, the person's skin and mucous membrane, if you look at, will look pale because less hemoglobin is there. Okay, so those are the signs. Now, anemia can be classified into different types. One type of anemia is insufficient erythrocyte that I have mentioned. Erythrocyte means red blood cell, right? So, lower number of red blood cell. Now, what can cause decreased red blood cell count?
A trauma or GI bleed.
Yeah, trauma, another one you said?
GI bleed.
Yeah, so, you know, if you get major surgery, right? Lot of blood loss, sudden blood loss occurs, right? Or road accident, right? Can cause sudden loss of lot of blood, right? So the count of red blood cell will be low. That is called hemorrhagic anemia. Hemorrhage means bleeding. Hemorrhage means what? Bleeding. So that is one. I said major surgery and accident. That will cause quick loss of lot of blood, right? So that's why it is called acute. Acute means sudden. Okay? Quick. Hemorrhage could be chronic too. Can you give me an example? Ulcer in your stomach. If from that ulcer, slowly blood leaks, gets out. Okay?
The medicine that you have to take every day, or like cancer?
That is a different type. Okay? That's not bleeding, right? If
Yeah.
bleeding, that medicine causes bleeding through your urine, of course. You know, some medicine can cause, chronic use can cause some blood get out with your urine, right? That way. So that, of course. Another is, you know, worm in the intestine, tapeworm or hookworm. They love to suck the blood, right? But slowly they will live there for years and will slowly suck the blood, right? So that will cause blood loss, but slow, long time, right? So chronic. So you got the example of acute and chronic hemorrhage. Is it clear? Okay. Hemolytic anemia. Lysis means breakdown, right? So if the red blood cell breakdown occurs, or rupture of red blood cells occur before the lifespan ends, early. What's the lifespan? 3 to 4 months, right? If in your body the red blood cells are destroyed after 1 month, premature, right? Destruction of red blood cells, that will also cause decreased number of red blood cells. Make sense? So that is another type of insufficient erythrocyte.
What could cause them to rupture prematurely?
Anemia. Yes?
What could cause them to rupture prematurely?
That could be a genetic disorder. Yes. You know, there is a type of anemia called sickle cell anemia, or yeah. So that will make the rupture cell membrane very weak and we get rupture. Aplastic anemia. Aplastic anemia is due to depression or destruction of the bone marrow. Who produces blood cells? Bone marrow. We know that, right? I have talked about that in last class. So, if destruction of your bone marrow occurs, then production will be less. Now, what can cause the depression or destruction of bone marrow? You know, excessive radiation. Now, that's why some people don't like to go through the airport. You know, they don't like when they do that. You know, scan. Repeated. You know, scanning or radiation can depress the bone marrow. So there are some medicines that can depress the bone marrow. Okay, so if that happens, the production will be less. Okay, so those are the insufficient erythrocyte-related anemia. Makes sense? The red blood cell count will be low. The number of red blood cell will be. Another is, I have already mentioned, another cause is lower hemoglobin concentration, right? So what can cause lower hemoglobin in the red blood cells? One type is iron deficiency anemia. So you all know that iron is needed for the hemoglobin, right? Synthesis. So if iron is not enough in the body, the synthesis of hemoglobin will be less. Okay? So that is iron deficiency anemia. Pernicious anemia. In this type of anemia, also the amount of hemoglobin is less because the synthesis is less. Why? Because vitamin B12 is essential for hemoglobin synthesis. And if someone's body has deficiency of vitamin B12, that will also cause decreased amount of hemoglobin in the red blood cell. So now you've got two things. One is decreased number of red blood cell, like this is one blood, healthy blood, this is healthy person, this is anemic person. This person has normal number of red blood cells, and this person has less number of red blood cells. So who will be anemic? This person, because decreased number of erythrocytes. Is it clear? Okay. Now you see another condition. Both have same number of red blood cells. Same number of red blood cells. But this one has normal amount of hemoglobin, so this is healthy. Is it clear? Inside the red blood cell, this person has less amount of hemoglobin inside. Makes sense? So although the number is same, right? But this person is what? Anemic. Makes sense? So not only the count of number will tell you that person is not anemic. Make sense? You have to see the amount of hemoglobin inside. So you have to make sure both are correct. Okay. Abnormal hemoglobin related anemia. Not only the amount is less, but if the amount is normal but the hemoglobin is abnormal, not functioning normally, so that will also cause anemia. Oxygen carrying capacity will be less. For example, this is healthy hemoglobin. This person also has enough hemoglobin inside it. But this hemoglobin, although the amount is good, but this is abnormal hemoglobin. The shape is different here, you see. This is not able to carry oxygen. So oxygen carrying capacity will be less here. Make sense? Because there are many abnormal hemoglobin content red blood cells. So this is anemia. So common types of abnormal hemoglobin containing anemia. One is called thalassemia. In this condition, the globin part of hemoglobin is 40. The globin part of hemoglobin is 40. Another is called sickle cell anemia. In this type of anemia, the hemoglobin is abnormal and cannot carry oxygen, and the shape of hemoglobin becomes sickle. What is sickle? Anybody?
Sure.
Short thing there, right? The farmers used to use in old time. So that hemoglobin becomes elongated and both ends become sharp. So when the red blood cell tries to pass through narrow capillaries, the sharp pointed ends, right, will destroy the red blood cell. Also, this hemoglobin is not able to carry oxygen. It cannot carry oxygen. So that is a serious clinical condition. In most of the cases, the patient eventually die. Okay, unless you. It depends on the intensity of disease. So it happens more in African black people. So it is a genetic disorder. Okay, the gene that is responsible for the synthesis of hemoglobin is faulty. Okay, so the hemoglobin will be hard. This hemoglobin is hard, elongated, pointed, and cannot carry oxygen. You see here, this is the red blood cell. Now, I said that due to genetic disorder, what happens, this is the normal sequence of globin, amino acids, say valine, histidine, leucine, threonine. So those should be in right sequence. Now, what happens, you see only small change can make the whole hemoglobin structure different. What is that? You see, instead of glutamine here, you have valine. So glutamine is replaced by valine, and that causes the change of the hemoglobin. Okay, so those are different types of anemia. Now we'll talk about another condition that is called polycythemia. Polycythemia is abnormally high number of red blood cells. So it's kind of opposite of anemia, right? In anemia, one type is decreased red blood cell, and polycythemia is abnormally high number of red blood cells in the blood. Now, what can cause abnormally high number of red blood cells? One is called Polycythemia Vera. This is a clinical condition that happens due to bone marrow cancer. Blood cells are produced in the bone marrow, right? So if you have cancer in the bone marrow, initially the amount of bone marrow increases, the activity in the bone marrow increases. So red blood cell number production increases and enters into the blood, the red blood cell. So that will increase the number of red blood cell significantly. So that is one. Another is called secondary polycythemia. This is actually not a clinical condition. This is called physiological polycythemia. Physiological or secondary polycythemia. Make sense? Physiology is not abnormal, right? Physiology is normal function of the body, you must remember. So, what is this? If you go on the top of high mountain, where oxygen pressure is low, right? So, how your body will try to compensate? By producing more red blood cells, right? Because red blood cells transport oxygen, right? So in that case, the bone marrow will produce more red blood cells.
What happens to your body if that happens? Like what are your
Polycythemia, if it is physiological polycythemia, okay, the response of your body is normal. When you will come back, it will again go down to normal. But if it is due to cancer, bone marrow, then it will gradually increase more and more, okay? And that will cause increased viscosity of your blood. What is viscosity? Thickness. Very good, right? So if blood gets too thick, it will not be able to circulate.
But it does
freely.
not cause like altitude sickness? That's not what
It depends how long you are staying there and how, high is that place. If it is too high, then your survival will be problematic. Then you have to carry oxygen tank. That's why people carry oxygen, right? So it depends how far you are going. But of course, if the red blood cell count increases, that will increase the thickness of the blood. Okay, the formed elements, right, that you know, will be increased. Okay. So one is clinical polycythemia, another is physiological polycythemia. Is it clear? And another that I don't consider as polycythemia, but this is also, you know, a condition where the red blood cell count increases. You know, blood doping. Have you heard that? So athletes, some athletes, it is not allowed. If you keep your red blood cell, take out the red blood cell from your body and preserve it. And before your game or performance, you inject the red blood cells back into the body. What will happen? The red blood cell count will go up, make sense? In the blood. And oxygen carrying capacity will go up. So you will be able to perform for a longer time, make sense? So that is for blood doping. It is not allowed, but sometimes you'll see in the news that, you know, athletes try to do that. Okay. So that's all about the red blood cells. Now we'll talk about the white blood cells, or WBC. White blood cells are two types: granulocytes and agranulocytes. First know that white blood cells are two types: granulocytes and agranulocytes. Granulocytes includes three types of white blood cells: neutrophils, eosinophils, and basophils. Okay? And agranulocytes, two types of white blood cells belong to agranulocytes: lymphocytes and monocytes. So first we divide the white blood cells into two groups: granulocytes and agranulocytes. Make sense? Then granulocytes include three types of white blood cells: neutrophils, eosinophils, basophils. Is it clear? And agranulocytes includes the lymphocytes and monocytes. Now you tell me, inside which type you have granules? Granulocytes, right? Name is telling you, right? A means absence. So agranulocytes don't have any granules. So if you see the cytoplasm of granulocytes, you will see granules, and that can be stained by dye. That can be colored by dye, right? Different dyes we use, or stain we use to color. Is it clear? This one doesn't have any granules in the cytoplasm. That's why agranulocytes. Okay. And we can color these granules by different stain or color. So that is 5 different types of white blood cells. Now, the count of white blood cells in your blood is 4,000 to 11,000. Okay, per microliter of blood. So, in 1 microliter of blood, you have 4 to 11,000 white blood cells. Is it clear? That's the normal range. Properties of white blood cells. White blood cells are different than other blood cells. Why? Because white blood cells have some important properties that are the properties of white blood cells. What are those? Margination, diapedesis, amoeboid motion, chemotaxis, and phagocytosis. What is that? Let me quickly show you. This is a blood vessel, and these are the white blood cells passing through the blood vessel. And if outside of this blood vessel, in nearby area, anywhere, any infection occurs. For example, these are the microorganisms, bacteria caused infection. So this is the site of inflammation. You know, infection causes inflammation, right? So these are the microorganisms outside of the blood vessel. So this is the site of inflammation. Okay. Now, white blood cells can detect that if any inflammation occurs. Okay. And these white blood cells will do what? Instead of passing through, they will get attached to the wall. So, inside the blood vessel, the white blood cells will get attached to the wall, and that is called what? Margination. Okay?
To like create a barrier, is that why? Or?
No, not barrier. I'll talk about that. Okay. This is called what? Margination. Instead of passing through the center of the blood vessel, going to the side, right? That's why it is called margination. Okay. Then we know that in the wall of the veins or capillaries particularly have pores. So what will happen next? The white blood cells will try to squeeze out through those pores. Okay, will try to get out through those pores. Squeeze. And that is called diapedesis. Diapedesis. Okay? Will squeeze out through the DIA. Yes, diapedesis. So we'll try to squeeze out through the pores. And then eventually they will get out and start to move towards the site of inflammation. Now the question is how they will move. They will move like anemia, amoeba. Have you heard amoeba? Single cell microorganism. So they will move like amoeba. Amoeba produces footsteps to move. Okay? So they will move like amoeba towards the site of inflammation. That's why this is called, that movement is called amoeboid motion. Okay? Amoeboid motion, like amoeba. Now another thing, what attracts the white blood cell to move towards the site of inflammation or infection? Because when infection or inflammation occurs, you know that some chemicals are released there. Make sense? At the site of inflammation, some chemicals are released, right? So those chemicals attract the white blood cells, tell them to come, okay, towards the inflammation. Is it clear? So that is called what? Chemotaxis. Chemical attraction. It's called what? Chemotaxis. Chemical attraction. Now, you know, in your body, sometimes what happens, opposite thing happens. For example, here some chemicals are present and the body cell is here. Instead of moving towards the chemicals, it will try to escape. Try to escape. Will think that chemical can destroy me. Okay, so the cell will move away. Okay, but in this case, cell is moving towards the chemicals, right? So this is called positive chemotaxis. This is called what? Negative.
What are some examples of negative
During, in your body, it happens all the time actually. There's some toxic chemicals are produced, okay? And the cells can sense that and will go away. And it also happens during the growth development of the body organs, okay? Some cells move away from certain area to form another structure. So they move it. That is in good reason. Okay. So some chemical changes take place, and some of them attract the cells, some of them will repel the cells, so go away from me and form another structure. So a lot of cases that happen. But mostly the cells escape. You will see the bacteria, virus when you put certain chemical, they will move away. You can see under microscope, certain chemical attract them. So if any toxic chemicals are released, certain cells can move away. So now this is called positive chemotaxis, and then what happens next? These white blood cells are now here, and they will do phagocytosis. Phagocytosis is the process by which the white blood cells engulf the microorganisms, right? So we'll engulf them and destroy them. So that's the purpose of all these, margination, diapedesis, amoeba in motion, and chemotaxis. The final goal is destroying the microorganisms or cleaning the area by engulfing the dead cells, because at the site of inflammation you know that cells die, right? So you need to clean those cells, dead cells. So that is also done.
Do they go back?
No, those white blood cells will not go back. Some white blood cells will be converted to macrophages. Macrophages, the phagocytic cells in the tissue, they will remain in the tissue and could be converted to macrophages. Okay, so here you see granulocytes, agranulocytes. Now, which type of white blood cells are most common? Neutrophils. Neutrophils are the most common. If you count 100 white blood cells, you would expect 50 to 70 of them are what? Neutrophils. If you count 100, make sense? You would expect 50 to 70 is neutrophils, are neutrophils. Second most common are lymphocytes. So lymphocytes are second most common, 25 to 45%. So if you count 100, you would expect 25 to 45 white blood cells are lymphocytes. So those two are very common. Others are present in very small number. Eosinophils 2 to 4%, basophils 0.5 to 1%. That means if you count 100 white blood cells, you can find one, right? Or if you count 200, you can find one. So it's like, a very low number. If I ask you in the exam, I would ask these two, okay? The number. So these two at least you remember which one is the most common and second most common. Now, how they look like. If you see a neutrophil, in neutrophil we see the nucleus is multi-lobed. This is one nucleus, remember, one nucleus, right? But it has multiple lobes. In this case, 3 lobes, right? sometimes we see 4, 5, or even 6 lobes. So if you see that, that is what? Neutrophil. The cytoplasm, neutrophil belongs to granulocytes, so it has granules, but these granules take both acidic and basic stain. So when you stain, acidic and basic stain, if you mix them, okay, will neutralize each other because it takes acidic as well as basic. Make sense? So that will cancel each other. So the granules are not stained. That's why it is called neutral. Okay, the granules are not stained. So that's why we see pale colored granules. Make sense? They take both acidic and alkaline or basic. If it takes, you should know, if it takes only acidic, the color will be reddish, red, okay? If it takes only basic, color will be purple blue, okay? If it takes both, it will be pale. Make sense? Okay.